Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Khokhar, Professor of Forensic Medicine and Toxicology. And as I am discussing personal identity, and this is the 27th lecture of this series, and in this we are studying the parameters of sex determination. And the contents of today's talk will be that I'll be discussing what are general examinations for sex determination and what are certain specific examinations. So the sex determination, what are the general parameters or general examinations which are done? General appearance. First of all, you examine and the general appearance look like a specific gender. The parameter used in this situation is facial features specific to a gender, male or a female. Then the pattern of hair distribution, pattern of clothes, female type or male type. The body figure, specific for both the genders. But these provide only presumptive evidence regarding determination of sex, because males of feminine type and the females of masculine type, they have been observed. Then there is gonadal examination, ovaries in females and testes in males. They are seen by naked eye and microscopic examination after gonadal biopsy. So these are the confirmatory examination for the gender. Then in doubtful cases, when the sex determination is doubtful, then we perform certain other examination, and it can be determined by a complete thorough external examination, complete body examination, and complete thorough internal examination of the person. Then by gonadal biopsy, nuclear sexing, and study of sex chromosomes. So these are specific tests to confirm the gender when there is any doubt. What is nuclear sexing? It basically helps in sex determination in doubtful cases, decomposed bodies, mutilated or fragmentary remains. Then what are the methods used for nuclear sexing? In female, the Barr body, the Barr body, and the Davidson body. And in males, study of the Y chromosome. What are Barr bodies? These were discovered in 1955 by two scientists, Moole and Barr, in all cells: skin, cartilages, muscles, and amniotic fluid, but more clear in the buccal mucosal cells. It is minute plano-convex condensation of the chromatin present close to nuclear membrane, and their size is 1.2 to 0.7 micron. And they are 20 to 80% in females, hence they are called chromatin positive, and 10 or less than 10% in males being chromatin negative. So if it is more than 20%, they are called chromatin positive, and if less than 10%, then chromatin negative in the buccal smears. So this is microscopic examination, Barr bodies on the neutrophils of the blood. Then from the Davidson body. Davidson body, it's a thin drumstick-like projection on the polymorphs nuclear lobe of the multi-lobe nucleus. So they are present in the neutrophils, polymorph nuclear lobes. It is absent in males. Its diameter is 1.4 micron. It is present about 6% of cells in females, and ratio is 6 into 20, that out of 20, 6 will be having these bodies. So this is a drumstick-like projection on the neutrophils you can see in the under the microscope. Then the study of sex chromosome. This is basically demonstration of sex chromosome XX or XY in the cells which are dividing, like blood, hair, and the tooth pulp. The Y chromosome in male is fluorescent to quinacridine. The hair root cells are important for Barr body and Y chromosome examination because they resist putrefaction. So this is a pictorial diagrammatic representation of various chromosomes. As we know, the half of the material comes from the maternal side and half from the paternal side. So this is just diagrammatic representation where the nuclear material is shared both the parents maternal and paternal. So thank you very much. These